California Memorial Project Monument at Patton State Hospital.
Beneath this granite monument lie the remains of some 2,000 residents of Patton State Hospital in San Bernardino. It is a simple and stark reminder of a dark period in California's history.
Archival photos of California state hospitals.
From the 1880s to the 1960s, more than 45,000 people with mental health or developmental disabilities passed away while living in state institutions.
Grave sites.
When no one claimed their bodies, the state buried the remains in mass or unmarked graves, only to be forgotten. Linda Thompson was with People First, a peer support group for people with developmental disabilities.
Gravestones.
She toured Patton and was saddened by what she saw thrown into a storage area on the grounds.
Linda Thompson, People First.
And there were these stones. They were about 9 by 9 square stones and just piles of them. And I was told they were headstones for the people who had died at Patton.
Archival photos of California state hospitals.
Since the first institution opened in Stockton in 1853, California committed many to state institutions for reasons that would be unacceptable today. Everything from epilepsy to dementia. Most of these institutions are long gone.
Grave sites.
However, the unknown graves remain. In 2002, 3 advocacy groups,
Advocacy group logos.
People First of California, the Peer Self-Advocacy Program of Disability Rights California, DRC, and the California Network of Mental Health Clients,
Grave sites.
came together to challenge what those mass nameless graves came to symbolize.
Sally Zinman, Executive Director, California Association of Mental Health Peer-Run Organizations.
And I remember at one of those meetings, one of the participants said that the way you were treated in death was indicative of how you were valued in life.
Grave markers.
And that people who had died in state hospitals and had not a memorial, just a stick.
The efforts of advocates led them to former state senator Wesley Chesbrough of Arcata.
Text of Senate legislation.
He sponsored 2 bills that addressed the deplorable conditions of the grave sites
Grave sites.
and sought to restore dignity to those anonymous people who were buried there.
Wesley Chesbrough, former state legislator, Arcata.
It's part of the evolution of our ability as a culture to treat people with disabilities who are with us today, not just in the past, as human beings. And one of the ways we get there is to understand the history and recognize the wrongs that were done.
California Memorial Project logo and legislation text.
Chesbrough's legislation created the California Memorial Project, CMP, signed into law September 2002.
California Memorial Project Monuments.
It called on the state departments of mental health and developmental services to create a task force representing persons with disabilities to do a number of things.
Michael Janus, working in office.
Michael Janus, CMP project coordinator for the Department of Developmental Services, is gathering important historical records.
Michael Janus, project coordinator, Department of Developmental Services.
Well, what we're talking about is compiling names of individuals, of people who were part of the system at one time or another, who were laid to rest without proper recognition in some cases. And so the compilation of those records, yes, are a reflection of actual individuals, and that's why another part, of course, of why the work is so meaningful.
Archival list of deceased individuals.
The task force is also identifying the location of all grave sites at existing state hospitals and developmental centers, and developing a plan to restore these sites and create memorials.
Michael Janus displays photos of CMP monuments.
These are just examples of some of the monuments and markers that we were talking about earlier.
CMP Annual Remembrance Day Ceremony.
of the blue.
This ceremony is another important part of CMP. It commemorates those who lived and died at the former Stockton Developmental Center, which closed in 1996. It is one of 10 locations across the state to annually hold remembrance ceremonies the third Monday in September. DRC's project representative, Alicia Mendoza, reads a few lines from a poem that captures the meaning of these important events.
Alicia Mendoza, DRC project representative.
So we who are gathered here today must look to the future and find a new way to preserve our dignity and quality of life, which protects the disabled by restoring patients' rights.
Archival photos of California state hospitals.
The CMP is also an important reminder that putting people with disabilities in institutions should never happen again.
Donna Shields at home.
DRC client Donna Shields successfully moved from the Sonoma Developmental Center to her own apartment with the proper supports and services. Now she enjoys simple pleasures she never could before.
Donna Shields, DRC client.
Going outside on my own. Riding my bike.
Donna is symbolic of the respect people with disabilities deserve in life.
CMP Annual Remembrance Day Ceremony.
While the California Memorial Project restores some bit of dignity to those individuals who died without that same respect or opportunity to live a different way.
No more graves left unmarked. You're not alone in the dark.
For more information or to get involved with the California Memorial Project, visit www.californiamemorialproject.wordpress.com.